So South Africa's vaccination campaign has suffered another major setback after the health regulatory body decided to halt the distribution of about 2 million vaccine doses that are currently stored in the Eastern Cape. This week, the U.S. Food and Drug Administration ordered 60 million doses of the Johnson & Johnson vaccine that are produced at a Baltimore plant to be discarded. This after they were found to have been contaminated. This is the second major snag for South Africa's inoculation drive after government was forced to sell millions of the AstraZeneca vaccine earlier this year. To get some perspective on the impact of all of this and perhaps a way forward, let's bring in public health medicine specialist Dr. Lehlohonolo Majake, who joins us via our video link. Doc, great to see you. Thanks very much indeed for making time. Let's start with the latest news. SAHPRA releasing a statement earlier this morning is essentially saying that they don't necessarily recommend that we use the Johnson & Johnson vaccines that are in the Eastern Cape. It's the last thing we needed.
Yeah, very good morning, Ayanda, and also to the viewers. I think you're absolutely right that it certainly is the last thing that is needed for us, especially when we look at the fact that we had a very ambitious target of having about 41 million people vaccinated by the end of this year in December. However, in terms of good manufacturing practice, it is the safest thing, given the fact that in Gqeberha, what they actually do is to complete the last cycle of creating the vaccine using the product that comes from Baltimore or Emergent Company. And I think we're all aware of the fact that there have been several things that have been transgressed from a good manufacturing perspective in Baltimore. And for the safety perspective of the people who are going to be given the vaccine, it really is a better thing to do, to be more on the cautious side, as opposed to exposing individuals to adverse events due to the fact that certain quality norms and standards were not adhered to in Baltimore.
Yeah. What this might potentially do is unearth that debate again about whether or not our government has deliberately, or perhaps not deliberately, but has really dropped the ball in trying to ensure that we inoculate as many people as we can in a shorter time period as we can. I wonder whether the criticism that we should have had a diverse set of vaccines is a warranted one for you. Because, again, in instances where one vaccine suffers the kind of blow that we have seen with Johnson & Johnson, we can just continue the rollout with other vaccines.
Yeah, I think the question actually cuts across multiple sectors, and I think for now we're focusing on health. But I also want to delve deeper later on into perhaps we need to start really bolstering our manufacturing abilities in the country. But I think in terms of the vaccination itself, you're right. We could have increased the other types of vaccines that we have. Because we are racing against time. And the reality is, even though it's been said, for example, the Sputnik or the Sinovac from China may not be as effective on our variant, there also is another counter-argument made by various scientists that, well, you know, on the other hand as well, there is some sort of better have 50 or 60% efficiency than nothing at all. So I think one thing that it speaks to is the fact that we need to bolster our public health response to such events such as coronavirus pandemic. But also what is critical, Ayanda, is health doesn't stand still and just wait for COVID to go past. We are in a country that has massive quadruple burden of disease. We know about HIV, etc. Mental health is on the rise. So we need to be far more responsive, and I think we need to be more adaptable towards managing multiple components of the health system as opposed to one at a time and waiting for science to come out at a time. So you absolutely are correct with that, because at the end of the day, nobody really knows the true efficacy of all the different vaccines from the strains. We know so far that J&J and Pfizer has been proven to be the best. But I think you're spot on that we could have bolstered the approach.
Right. Many people will say that what's happened with the J&J vaccine, what's happened with AstraZeneca could have not been foreseen. Nobody would have guessed that stuff like that was going to actually take place. But does that absolve government, though, from ways through which they have dropped the ball?
So for me, I would actually look at government in totality and not just only in the healthcare space. You know, right now when we talk about health, from a public health perspective, we look at all components. Education, the economy, the ability to generate money, and so forth. And I think this situation speaks to long-term interventions that could have actually been put in place long before COVID came through to ensure that we can still continue to live as normal as possible, even with COVID-19. So I think, yes, of course, in terms of the reactive response to COVID and having the vaccines, that is something that is out of our control. But in terms of the journey towards really getting South Africa to be a healthy country, I think there's far more we could have done. The biggest question now is where are we with our pharmaceutical industry? You know, and I think that's a conversation that we need to start having. What is stopping South Africa from actually being vibrant in that economy and creating its own vaccinations? I know, of course, now with COVID, it's different. We are talking about patents and so forth, and I know that the president is out on communication with the G7 and see if we can actually, just have ways in which we can fast track countries being able to make their own generics. But the space that we need to really start venturing into is, but what about other sectors that equally contribute towards the health of the country?
Yeah, and perhaps let's go there now. I mean, how else could other sectors of government come to the party, given how, do we say, health is struggling at the moment? It is a global health crisis, but it takes more than just health stakeholders to fix this moment that we're going through.
Okay, so for one, we're saying that we proudly vaccinated about 1 million of individuals over the age of 60. If you look at what we call South Africa's population pyramid, which is basically another fancy term for the number of people over 60, in the country we're looking at about 5 million individuals. There are some debates that while certain people in rural areas can't get access to, EVDS or the electronic system, and then there's calls to say, could you please let us know if there are areas that really are in need and where individuals can't get any access to vaccines. Can we do census? We have an idea of how many people we have in the country. How do we know that we have 5 million people across the country? So we could have used departments such as your Statistics South Africa to really try and help us with geomapping to understand just the scale of individuals who need to be fast-tracked for COVID-19 vaccine, in this case, individuals over 16 who really are at risk. And have more innovative ways in which we could step in and have them far earlier registered on the EVDS. We're also talking about the fact that we've got challenges with youth unemployment, and of the 30% unemployment over 60 are youth. We could have utilized this period right now to really try and train our youth so that they could actually go out and become healthcare workers and assist. Basic healthcare workers and assist us with really tracing those individuals, obviously ensuring that we also are protecting our youth from COVID-19 while doing the work as we do with our healthcare professionals.
Yeah, there's going to be a desperate need for solutions moving forward. That's what we could have done. The question now is, what can we still do moving forward?
Absolutely. And I think for now, of course, we're not really going to be looking at things such as herd immunity, which is what we really needed to do to make sure that we have as many people vaccinated so that if one person is infected, the other few people are then protected and that we get to 60%. But given the current global challenges, the current challenges we had with procuring of the vaccine, the current challenges we anticipate with actually giving out the vaccines, we're going to have to look at containment. So, of course, it's the issue of masks. Of the basic areas that we've been talking about, washing hands, but then also affordability of those essential items as well is not always, feasible. So what is it that we can actually do to bolster that? We're in the winter season now. A lot of people are huddling into their houses, and we're not talking of basic houses with bricks and so forth. We're talking about numbers of people huddling in a household that then predisposes them to getting the infection even far more now as we are in the third surge. We're talking about commuting as well. Many people are using, your taxis and so forth for transportation. Again, in winter, you're not going to have ventilation. So what is it that we can do in those spaces? Prevention is definitely better than cure. And I think in this instance, we really need to have ways in which we can preempt certain behaviors in our communities that will then increase the number of cases that we have.
Right. Speculation rife, even if you look at the morning papers on this Sunday morning about the possibility of a tougher lockdown given the trajectory of our COVID-19 infections. Is that something you'd throw your support behind, a tougher lockdown?
So again, from a health perspective, as just looking at the health component and the hospitals and the fact that they're currently overburdened, one would immediately say yes. But when you look at it in totality, as I've explained, that when we talk about social determinants of health, commuting and going across different provinces is certainly many things that many people rely on to ensure that they continue to fund themselves. So from an economic perspective, we need to look at the feasibility of that as well and just how long we would do it. So there are various variables that we need to look at. I think what is also important right now is to look at how it is that the people who are most vulnerable get infected. And perhaps that's one area that we need to look at and to see how can we curtail that. And for now, apart from, the basic containment, it's vaccinations as soon as possible. So that's one thing I would bolster for. So I wouldn't just immediately say yes. Probably at a later stage, if we continue at the rates we are with our infective rates and our positivity rates stagnate at about 16%, we might have to look at a slightly an increased level of restrictions. But we need to factor in that these are just simply for that period of time. And what's the purpose of it? It's supposed to try and reduce the spread of the infection. And if you don't have clusters or segments that show high levels of increase, you're not necessarily solving the problem in totality for a long time. So it's a convoluted, multifaceted problem that we need to look at.
Dr. Majake, let me thank you indeed for your time. Really appreciate your insights. Dr. Lehlohonolo Majake is a public health medicine specialist. Thanks very much indeed once again.